We're with Dr. Clem Jones with the Spine Care Institute of San Francisco. You may not have heard of him, but there are many people you watch from the stands, say over at Memorial Stadium in the East Bay or at Candlestick Point. We're talking about professional athletes and elite collegiate athletes that you see on a regular basis. But what are the most common spine injuries you see when you treat these players?
Well, predominantly in football players, we see a lot of neck and back injuries.
Yeah.
But spine injuries are very common in all athletes, whether you're in a high-impact sport or you're doing low-impact activities as well.
And not only do you see your work performed here at the Institute, but you get to go see that directly on the field, how it's actually turned out for these players.
Yeah, I sort of live and die with these athletes when I'm on the field because I live vicariously, through them. And if they win or lose, I win or lose. It's a great experience.
Is there a lot of pressure for you to make the call of whether to tell somebody, yes, you can go out running in or go back out on the field and play for Cal or the Niners?
Yeah, specifically, again, with elite collegiate and professional athletes, their livelihoods depend upon their ability to continue their sport. So we have established criteria for them to be able to return to play.
How important is it to not go out on the football field on a Sunday with your buddies and play mud football? Or go on the golf course if you haven't golfed in a year and a half without exercising or stretching?
You have to think about the spine as a framework that your limbs are attached to. And it doesn't move very much. So the way you get power and speed is based upon muscle strength and flexibility. The most common thing that a lot of people do recreationally is golf.
There you go.
And there's a sport where a lot of people have neck and back problems because the swing is a thing. But if you have the wrong technique and you're trying to generate a large force as your club head hits the ball, if you don't have good core strength and good posture and form, you're going to have problems.
Do you golf?
I don't golf. It's too frustrating for me. I'd rather run into somebody but instead of hitting the ball.
The stress would cause a back problem, I imagine.
No, but the point is, it was well taken that clearly any of us can have a problem with their spine, particularly the recreational athlete or the weekend warrior, as we talked about. But the most important thing is to make sure that you're aware of yourself and where you are, your position, having good form and good strength.